key points. Now, I want to give you several reminders about phase 1 of the vaccinations. Remember, we are still in phase 1, and only those who are qualified in phase 1, including people 75 and above, can now get the vaccine. If you don't qualify for phase 1, you will have to wait. The Department of Health just announced in a newspaper article today that possibly next week or in 2 weeks, the vaccine may be available to those 65. So that is good news. I also want to tell you that all locations that you go to, whether they're state or local or CVS and Walgreens, they are all following the Department of Health guidelines to make sure someone is qualified. For example, if you try to go to the state website and you can't sign up because you're not qualified, and you think maybe you could go to Walgreens or CVS, you can't. They're all following the same guidelines, and you have to wait until it's your turn to register. Also, you can never just walk in. I know I already explained a little bit about that, but you have to register online or call. I know that some of the senior citizens don't have access to a computer. And if you feel you need support with scheduling an appointment, you can contact one of our 4 community support team members. We have a senior citizens committee, and the people on that committee are Bonnie Abels, Jane Canula, Jennifer Malloy, and Nancy Vanaco. Contact any of them and they would be pleased to help you and explain how you can sign up for an appointment. Now, remember, there are only 2 companies producing the vaccine right now that have been approved by the Food and Drug Administration. And they've tested it and made sure that it was okay for use. Those 2 companies are Pfizer and Moderna. Suppose you go to get a vaccine, ask them which company's vaccine you're getting, and they will show it to you. Make sure that it's either Pfizer or Moderna before they give it to you. I really highly doubt this would happen, but if there's some other company name on it, don't accept the vaccine. But I don't think that'll happen. I just wanted to put it out there. And you know, they only have Pfizer and Moderna, but both of them require 2 doses. You get the first vaccine and then you wait 3 to 4 weeks and you return and get the second shot. Now, the reason that there are 2 shots is because COVID is so new and they have not completed 100% of the research on it yet. So they're still finding new things, and they wanted to give your body time to react to the first dose instead of a large dose. So they broke it up into 2 doses. So you get the first dose and it enters your body and kind of lets your body know there's a new germ. You know, it's like, hey, I'm here, and your body gets ready to protect you. So I'm using that as an example, but that's why there's 2. It's divided up. Now, I do know that Johnson & Johnson, they are hard at work saying that they're making a shot that would just be 1 vaccine, but it has not gone through the FDA approval process yet. So that could happen in the near future, but we'll keep you informed about that. But it's really just important that you know there are only 2 companies making it now that are approved, Pfizer and Moderna. And when you go to your vaccination appointment, they will give you an ID card. And it is very important to keep this. Like your driver's license or your social security card, very important, this card. They will write on it for your first and your second appointments. And it's possible that COVID won't necessarily be over and they won't be done with the research, and they might find that 2 is enough, or maybe 2 is not. The CDC and the companies who make the vaccine feel that this COVID will probably last another 1 to 3 years, maybe 5, but they may discover that you might need another vaccination in 6 months or a year. No one really knows yet, but please keep that card. It's so important. It's not for public information. You don't want to share it with people. It's your private record with your name and the vaccination and your ID number. And then lastly, after you get both of those vaccines, you might think, I'm great, I'm fully protected, I don't need to wear a mask, I can hang out with my friends. The CDC and the Rhode Island Department of Health are both saying that the research is not concluded. And we don't have a vaccine for children under 18. We don't have a vaccine for babies yet. So even though you've gotten your 2 shots, you still need to wear a mask and follow social distancing rules, the same as we have been doing. And Rhode Island will let you know when it's okay for us to stop wearing masks. So it's very important, even after you get the vaccine shots, you still have to wear a mask and do social distancing because you're helping to stop the spread of the COVID vaccine. I think that masks will last probably another year, I think until the end of 2021 or even into 2022. So I would just set your expectations now that you've gotten the vaccine perhaps, but you still need to keep, just within your family, within your household, 1 or 2 people. If you have any questions or you need any clarification, please feel free to call Rhode Island Commission on the Deaf and Hard of Hearing. We would be happy to talk to you and help clear up things, or also our Senior Citizen Committee. You can call one of those 4 people and they would be happy to help you. They know the information and feel free to contact them. Okay? Thank you so much.